Good afternoon, everyone. It's Alan Harris, Emergency Manager for Seminole County. Today is April the 7th at noon, and giving you an update here today on our response to COVID-19. We try to do this every Tuesday and Friday at 12 noon, and we will answer your questions as they come in. And I'll also just provide you some general information on what's going on here in Seminole County. First, of course, I always talk about our wonderful people at the Citizens Information Hotline. They are staffed 7 days a week. Florida Department of Health and emergency management personnel inside of the Citizens Information Hotline there to answer your questions. Their telephone number is 407-665-0000. Again, 407-665-0000. Our website is updated with lots of great information, prepareseminole.org. Just about everything that you would want to know, government closures, city closures, county closures, all types of information related to that. The executive orders that have been issued by the governor as well as Seminole County are all listed there. We try to provide a lot of great information for you so that you can respond effectively to COVID-19 and get the information that you need. There are a lot of executive orders out there. I'll talk about a couple today. The first one is the kind of the big one, if you will, and that's the governor's executive order. The governor's executive order issued to shelter in place and indicated what essential and non-essential businesses were. So the governor established those non-essential businesses should close to protect individuals from COVID-19, and then the essential businesses could operate in the county and across the state of Florida. In that executive order, it also said that individuals that are 65 and older should, actually it says shall, stay at home. So by every measure possible, we are asking individuals 65 and older and also people with underlying medical conditions to go ahead and stay home to protect themselves from COVID-19. Seminole County had issued a couple executive orders prior to the executive order issued by the governor. Those executive orders don't go away. Those executive orders are complementary to the governor's. So the governor's executive order discusses what essential and non-essential businesses include. Seminole County's executive order never did that. Seminole County's executive order was issued prior to the governor's. We did not indicate essential versus non-essential businesses. We said that all businesses, regardless of what type of business it is, whether it's a hardware store or a beauty salon, to whatever, must do social distancing. Social distancing related to CDC guidance and the White House medical team's advisories. So that guidance includes 6 feet distance in between employees. So if you have a business and you have a lot of employees in one location, 6 feet in between those individuals, 6 feet in between the individual and patrons. Also markings on the floor, that was included in the social distancing executive order, and no groups of 10 or more. So if you're going to have a meeting or training class or something like that at work, there should be no more than 10 people in any of those. It further goes on to discuss social groups, so social gatherings, things like that, should have no more than 10 people. In addition to that, an executive order was issued for places of assembly. So places of assembly could be fraternal organizations, service organizations, faith-based organizations, any organization that meets for a specific type of purpose. We are saying you must follow the CDC guidelines. CDC guidelines, again, saying 10 or less people. CDC did put out guidelines specific for community and faith-based organizations. You can find that on their website. And when you look on that webpage, it is important to go to the very bottom because it lists different types of community transmission. So minimal community transmission, moderate, and then substantial. So in Seminole County, we have substantial community transmission going on right now here in the county. So that means that you should follow the guidelines based on substantial community transmission. Just to give you the numbers right now, I'm going to look over at the board. Right now we have 204 positive individuals that have identified as positive individuals through testing here in Seminole County. So that's from the beginning until right now. We have 204 individuals. I said that right. 204 individuals that have tested positive for COVID-19. Okay, so of those, 75 have gone past their isolation and quarantine time. So just like if we had the flu or something like that, and we're really sick for a couple days, and then we get a little bit better, and for COVID-19 you get a little bit better, and then you have to wait some more days before you get off of that isolation and quarantine. So 75 of the 204 have come off of the isolation and quarantine requirement. That means they've gotten better, they feel good, they've gotten past the quarantine time, and now they are able to go live their life. So that's a good number. I like to give good numbers, not just all bad numbers. So that's a good number. Those 75 individuals now are able to live their normal daily life as it is right now in our county and across the state of Florida. So they can go on a hike, or they can go on a trail, or they can go to the store if they want to, or something like that. In the county total, right now we have 388 individuals that are isolating and quarantining in their house. So that means that they are either part of that positive number, minus of course the people that have come off and they've gotten better and they've come off the isolation and quarantine, or they've come in contact with someone that was confirmed positive. So those individuals are asked to stay in isolation and quarantine. So Fred, you asked how many have recovered. So we say that they have gotten better and they're off of their isolation and quarantine. So 75 currently have come off of their quarantine. So they've gotten better, they feel good. Now they've, after they felt good, they have gone to the additional days required. They have no signs, no symptoms. Just like if we had the flu, they are back to normal. Okay, back to normal life, as we can be right now, right? So it's not 100% normal, but most of us are quarantining and isolating in their home, and I know that I am. The second that I leave here from work, I go home, I go inside, and I don't leave the house. The only time that I leave the house is maybe to walk the dog, to walk the dog certainly, and then going to a store. So I may go to a store to pick up some items, try to pick up all the items for an entire week, so I don't have to go to the store very often at all. So some folks have asked about faith organizations based on the executive order. We are coming up on, of course, a very important holiday for the Christian faith, Easter. And there are lots of different ways that you can enjoy faith. Faith is a very important part of my life, and I know it's an important part of many people's lives here in Seminole County. We want you to enjoy the Easter holiday as best possible. So there's a lot of different ways safely that you can do that. You can do drive-in church. We saw some of that over Palm Sunday. You can do online services. We have seen online groups, online chats going on. We've seen apps like Zoom and Blue Jeans and things like that, where Sunday school classes can get together and celebrate together. You can be in groups. If you are 10 or less, you can get in a group of 10 or less. So we ask that you be in social distancing, 6 feet apart, but you can certainly do that if you wish to do that. So I hope everyone here has a very happy and safe Easter, however you wish to celebrate it this year. Ryan asked about the hospitals. Do you anticipate an ICU shortage? Is a temporary facility being built? Ironically, Ryan, I just got off the phone. Regionally, we are discussing that. So I was on the phone with Jerry Demings down in Orange County and the folks in Osceola and Lake County discussing where a regional hospital may be if we ever have to do that. Current capacity in our hospitals is actually relatively good. We're about at 70% availability in our hospitals, so that's better than many days. We currently have 12 people in our hospitals with COVID-19, and we have 2 individuals that are on a ventilator in the hospital. So our ventilator count is really good. Over 60% of our ventilators are available right now, and then over 70% of our hospital beds are available right now. That's our normal count. So that's our day-to-day count. That's if you went into a hospital, last month and you needed surgery, that's the count that would be there. So the hospitals also have surge plans. So what does that mean? That means that your normal capacity in Seminole County is around 860 beds, say to say. Well, they bring in additional beds to enhance their capacity. So for surge, and that means doubling up in rooms. That means maybe using a conference room as a space where hospital beds would be located. We can increase quite a bit more than 1,000, mid-thousands for hospital beds in that type of situation. And then, if it starts to exceed past that, then we would look at a regional hospital. But we, of course, have to plan for that now. So that's what we were doing just a few moments ago. We were planning for a regional hospital, hoping that we never ever have to do that. But we have that in planning. Yvette asked about testing, and it's always a very good question. So currently we have 21 testing sites available. Of those testing sites, we have 4 of those are for the uninsured or underinsured. So we certainly, if you would like to go get a test, there are a lot of different ways to get tests right now. So let me pull up the list here. I always try to go over the list with y'all. Hey, it's Alan Harris again. With emergency management, and I had a computer problem. Oh, my computer came back up. How wonderful. But we'll go ahead and do this. This is now on a iPhone, so sorry about the interruption there. So let me see. Okay, let me see if I can get this here. So I apologize about that. So let me go through some of the questions that I did see. Tony asked about the boat ramps. Right now, currently, what we have is we currently have the boat ramps and the playgrounds closed. So the boat ramps and the playgrounds are closed here in Seminole County. That is not something, of course, we wanted to do over the weekend. We were hoping that, and we actually had some relatively good response to our pleas to limit the amount of people on the river and things like that. So unfortunately that did not take place on Saturday. We had a tournament that was scheduled, and we had some parties that were going up and down the river. So we don't want to do closures or anything like that. That's not what we want to do. We didn't want to close the playgrounds, but we had to close the playgrounds. We didn't want to take the rims off the basketball courts, but we have to take the rims off the basketball courts because unfortunately individuals were collaborating around, of course, the basketball courts, and they weren't in groups of 10 or less. So we did close down the basketball courts. We did close down the playgrounds, and unfortunately we did close down the boat ramps. We have had some discussions about reopening the boat ramps. So right now there isn't an exact date for when that would occur, but that is something that we're continuing to look at. So David brings up a good point about commercial fishermen. So we did talk to Volusia County. Volusia County's boat ramps did stay open. So the commercial fishermen that we've talked to, we've informed them about the Volusia County boat ramps, and they have said, the ones we have talked to at least have said that they plan to go ahead and use those for their commercial activities. So Jason asked about why do kids have homeworks that require supplies that need to be purchased? That is a good question, Jason. I will pass that on to the Seminole County Public School System. I do not know the answer to that. We certainly don't encourage, of course, individuals to go to the store a lot. Once a week, I try to go to the store and get my food items, and we certainly don't want to encourage a lot of people going to the store a lot of times. We want to limit the amount of times. So I can't answer that question, unfortunately, but I certainly can pass that on to the Seminole County Public School System, and maybe they can push that down to the teachers to find different ways of doing homework. Can I take elderberry syrup for the COVID-19? So there's a lot of home remedies out there and a lot of discussion. So instead of me going through each and every one of those, it's a good question. It really is, because there's questions about ibuprofen. There's questions about, I've seen silver and zinc. There's questions about different kind of medications that you can get on. It's really important just to go to the CDC website and Google search these on their website, and you will find lots of medical information about any types of these home remedies, because many of these home remedies, they have proven, are not really effective. on COVID-19. I know that they're trying their best to find something that will be effective with COVID-19, but it's just important to go there and to research that. How many cases are in Chuleota? I think there's about 2 or 3 cases in Chuleota. Unfortunately, my computer went down, so I'm going to look at my planning people and see if they can tell me how many people are in Chuleota to do that. So they're going to do that for you, Holly. So I'll have that for you soon. Rob asked about hospitals again. The hospitals are doing pretty well. So we currently have 12 people in the hospital with COVID-19. 2 of those individuals are in ICU and they're on ventilators. And so there's not a lot of people in the hospital right now with COVID-19. So we have 3 people in Chuleota that has COVID-19. And that's so it's pretty. When we look across the county, and I know people want to know, well, how many are in my city? How many are in my city? It's pretty similar across the entire county. So when you look at the red dotted map, there's red dots everywhere across Seminole County. So not any specific community has a lot more than others. Obviously, when we did our heat map, the more populated areas will have more patients because there's more people there. So yes, we are seeing Altamont Springs and Sanford and Oviedo having a concentration, but that's because there's a concentration of people there. That's not because there are more cases per person than anything. It's just there's more people there. So that's a good question, Fred. Of the 75, how many were hospitalized? I actually don't know that statistic, so I'll have to try to find that statistic. Suzanne asks about our mayor. So Seminole County doesn't have a mayor. It has a chairman. There's very few counties that have mayors. Only in this state, I think there's only 2 or 3. Mayor Demings, of course, being the Orange County's mayor, but most of the counties in the state of Florida have boards of county commission, and then there's a chairperson for that board. And Jay Zimbauer is our chairperson. So it would be like a mayor, if you will, but he is a chairperson. He is on every one of our press conferences, so he's the guy that gets in, stands up front at the very beginning and ends the press conference. Does a great job leading the board's initiatives in response to COVID-19. Carol asked, if a co-worker's spouse tests positive, do all the co-workers need to self-quarantine? So if the co-worker's spouse, no, it would just be the co-worker themselves. So if say, my spouse gets COVID-19, then I would need to not be here. But the rest of the people here in the EOC could continue to operate, so they could continue to work. Heaven forbid that happens, but if that's the case, then I would quarantine and isolate at home until my 14 days are passed and I have no signs and symptoms. Stacy asked how many in Sanford. Again, the numbers change all the time, but there's nothing really less than 2 there's nothing actually less than 3 in any city, and there's nothing more than 12 in any city. So, but again, Seminole County is a little skewed. So Seminole County, there's city limits and there's unincorporated areas. So sometimes you may be have an address of Altamont Springs, for example, which are actually in the county. So you would not be listed in the city's numbers, but you could be right next to the city. For example, the gas station at 436 and I-4. So that's in the heart of Altamont Springs, right? That's actually county. They were never annexed into the city, so that is a county address. So even in the heart of Altamont Springs, if someone was COVID-19 that lived at the gas station, which doesn't happen, of course, but if it did, that would not be included in the Altamont Springs number. So it's a little bit skewed on that. Veronica asks, did Altamont Springs close Crane's Roost and all the other parks? Yes, they did. They did that yesterday as an abundance of caution to protect people from COVID-19. We have left our parks open but the playgrounds are closed. We did have a couple people that had called, and they were upset, and they said, well, we're going to play on the playground anyways. Please don't do that. Please, we're begging you. Those playgrounds that we could lock, we locked, but the other ones we put signs up, and it's just not safe. It's a common area. You can touch it. If you send the children out there and they're touching the common area and then they touch their eyes, they can get sick. And that's the whole reason that we do anything here, is we want to protect lives. We want to save people. And that's why we do what we do. We don't want to do anything. We want the parks to be open fully. We want the basketball courts to be open fully. We want the boat ramps. We are Florida's natural choice. It would be wonderful if we could have the playgrounds open and the kids playing, and the boat ramps open, and the rims on the basketball courts, and people were just enjoying life. We would certainly prefer that over what's going on right now. But unfortunately, that's just not the case. So we're doing what we do to protect ourselves, protect the community as a whole. And Altamont Springs, unfortunately, had to make some decisions yesterday, and Altamont Springs made the decision to go ahead and close that. Kenneth asked, are there any deaths in Seminole County? Unfortunately, over the weekend, we did experience one death in Seminole County. And I know this is probably really hard for y'all, so I'm going to try to position this. Also, my hand is getting tired. So there you go. So, but we have one death here in Seminole County, and the individual is a 91-year-old male. And we had a moment of silence here on Saturday for him and the family. Please keep his family in your thoughts, and certainly pray for them as they go into a holiday season without their loved ones. So we were hoping that we would get through the entire pandemic and not have any deaths here in Seminole County, but unfortunately we did. So Rebecca asked, how can a single kayaker access the waterway? The Little Econ, I know some people kayak on that. They kayak on the Wakaiva. So if you wanted to do that, there are some private boat launches that you can get to. There are some boat launches that are right off roads and things like that you can get off to. They're not managed by the county, so if you wanted to go out and do some kayaking, you could do that. Let's see. Haley asked, split custody parents, should the kids stay in one home? That is going to be a difficult, challenging discussion that you two are going to have. It depends. If both family members are isolating and quarantining in their house, then it's safe to move the individuals back and forth. That's fine. The children can certainly go back and forth. If if the ex works in a high-profile job, y'all are just going to have that discussion and see what's the safest. The child's the most important thing in this discussion, right? So we want to keep the child safe. So if the individual's going to work every day and they have frequent contact with individuals and things like that, you're going to have that discussion. It's not going to be an easy discussion, but you are going to have that discussion. Reimer asked about the recovered people. Again, the recovered, what we say is the person has no signs or symptoms, and the person has now gone past the isolation and quarantine period. So go ahead and do that. So there are 75 individuals that have come off of isolation and quarantine that did have COVID-19, and they have no signs and symptoms. Financial loss programs. So Avi asked about financial loss programs. So yeah, there's a lot of people that are furloughed. There's a lot of people that are in very, very challenging times right now. On our Prepare Seminole website, it has links to different grant programs. It has links to assistance programs, unemployment, a lot of different ways to try to get assistance. So certainly you can go to prepareseminole.org. You can also call our Citizens Information Hotline. They can connect you over our Community Services Department, which is also working on this initiative to help people in their big time of need right now. Arlene talks about the unemployment website and the problems with that. We have heard the same thing, that there are some problems with that. Later in the evening is easier. There are less people getting on it. Very, very early in the morning, we have heard that some people have had some great success You'll have to wake up before other people, but there is some great success about that. And we are looking at printing out some unemployment application documents and putting it up at a location. I know that some state representatives have already done that around their offices. So you may want to check with them, but we're also looking at doing it here in Seminole County as well. When Lisa asked, when will Seminole see a peak in COVID? So there are a lot of different models, and we actually were in a conference call just a little while ago to look at some of the models. A lot of the models say by the mid-month time period that we could be seeing that. There are also some models that push it off till May, and I hope that's not the case. I hope it is mid-month here. So we have seen a slowed, very light decrease in the number of positive cases coming in each and every day. But that's something that it may be a temporary thing. So we're going to look at that. We do look at that continuously. Charlene asked about people with symptoms and testing. So we asked Charlene that individuals call ahead. They call the urgent care center. Again, 21 facilities. Oh, that's what I was going to do. I was going to try to get those facilities for you, wasn't I? When the computer froze up. So let me see if I can do that for you. We'll see. But you want to call ahead to make sure that they are ready, that they are protected, and that they have the appropriate PPE before you get there. They will test you if you have the signs and symptoms for COVID-19. If you do not have the signs and symptoms for COVID-19, then they will not test you. It's kind of like if you go, again, to the doctor's office and say, hey, I want a flu test, and you don't have the signs and symptoms for flu, they're probably not going to give you a flu test. So, just know that they're going to ask you what your signs and symptoms are. They're going to take your temperature. They're going to do those things, and if they see that there's a need, they will certainly provide tests. Herman asked, is there plans for tests of all residents? Well, not just open testing for anyone that doesn't have signs and symptoms. And unfortunately, we just simply don't have a number of tests for every single person without signs and symptoms whatsoever to get tested. So, I hope that will be the case at some point, but that's just not the case right this moment. So you do have to have signs and symptoms for a testing. So you need to have signs and symptoms. But if you do, again, there's 21 different facilities, and I'm trying to get the thing right here so I can tell you what those facilities are. It'll take me a second, but while I'm doing that, I will answer another question. Veronica asked, why did Altamont close Cranes Roost Park? Every decision that's made is very challenging. I can tell you, none of the decisions that we make as a group here is an easy decision, and I know that the city of Altamont Springs folks discussed this for a while before they closed the park. Cranes Roost Park being one of the icon parks in the Seminole County area, and certainly something that everybody enjoys. If you've lived in Seminole County for any period of time, I used to live directly across from Cranes Roost Park, and I used to love to go over and walk around the park. It's just a beautiful location, beautiful scenery, but they had to make a very difficult decision to close that park, and I know that wasn't an easy thing for them to do. They may have seen something, gatherings of people or something, that required them to do that. Very similar to us. This Saturday, we did not want to send parks people out and to close down boat ramps. We did not have that planned for the day. That was not anywhere on our schedule. That was nothing that we wanted to do. Unfortunately, it's just to protect our entire community from COVID running rampant in our community, and healthcare systems being locked down, and nurses and doctors being sick, and first responders being overtaxed. We had to do some the methods, and Altamont Springs unfortunately had to do that method yesterday. I don't know what caused it, but I'm sure it was something that was requiring lots of law enforcement staff and other things, park staff, etc., to make them do that. So they made the wise call to do what they needed to do to protect their city. Rebecca asked, if an essential employee tests positive, what should the employer do? The epidemiology team with the Florida Department of Health will inform the employer what to do. So they will tell the employer what to do. So for example, here we're all about 6 to 8 feet apart from each other, and we're doing that continuously so that only the very closest people may have to isolate and quarantine if one of us gets COVID-19 positive. We actually have people on the other side of the building that I don't even see. In fact, we have to call each other, or we have to do a thing like this, where that's the only time I get to see them. I may see them out in the parking lot as they get in their car and I get in my car, but we don't see each other. So in that case, all those individuals will be fine. So if you enter into a business and one employee gets sick, that doesn't necessarily mean the entire business is closed down. If you're separating into teams like we do here, if you're separating into different work groups, and you're separating into different spaces, then it may be just a small amount of people that are asked to isolate and quarantine. That'll be an epidemiologist that makes that decision and discuss that with your employer. Technicians are going to, Elisa asked, technicians are going to house calls and not warned about suspicious COVID cases. Yeah, right now, if I'm a technician or if I'm a home repairman or anything like that, I'm going to call ahead and I'm going to ask them some pointed questions before I go over and try to repair anything. So I would ask that any electrician, plumber, construction worker, handyman, anything like that, if you're going over to someone's house to repair anything in their house, please ask them some questions. Hey, have you been sick? Anyone in your household been sick? And make sure that you are comfortable with those individuals before you go over there. Lynn asked about non-essential business list. The only list that we know is at the floridadisaster.org website. So floridadisaster.org, it lists the essential businesses. It doesn't list the non-essential businesses, but it does list the essential businesses. So if your business is not listed in essential businesses, it would be non-essential businesses. If you're upset about that list, again, Seminole County did not make that list up. None of our executive orders reference an essential or non-essential business whatsoever. We don't talk about that in our executive order. So you would want to go to the state's website. If you disagree with their essential business list or non-essential business list, we did not make that list. So you can complain to us, but there's nothing we can do about it. We can send a message to the state, but that's about it. So, but that is where you can find it. What is the expected recovery time for patients? Reimer asked. About 14 days is when they come off of isolation and quarantine. We've seen many patients getting better about 4 to 7 days. Someday it just depends. So, and I hate to answer a question with it depends, but that's the truth. So do you have underlying conditions? Do you have other medical situations? Are you on certain types of medication? All of those are going to be factors in how fast you can get over. Are you in good health? Do you exercise regularly? Do you have good oxygen, lung capacity, things like that? Are you a runner? Those are all going to be different things that you're going to have to look at. So we are a little over. I'm going to answer the questions that we have here, and then I'm going to end because I had the little break in between. So any cases in the jail? Lauren asked, any cases in the jail? No, there are no cases in the jail. Ada asked about financial assistance for freelancers. Yes, you can still apply for financial assistance. So please go to prepareseminole.org, click the finance section, and it'll give you all the information about financial aid. Tony asked about Volusia County stats. So I don't know specifically about Volusia County stats, but I can tell you the website to go to. Just actually in Google, just type Florida Department of Health COVID-19 and hit enter. Florida Department of Health COVID-19 and hit enter. You'll go down about halfway on the web page and it'll say Get Dashboard. So click on that Get Dashboard and you go to any county and you can see what the current cases are. Now that's always going to be off a little bit because they only update it once a day, but you'll get the current counts, you'll get the number of tests, positive, negative, how many are waiting. You'll get the total number of patients. So look at the tab at the bottom. It's got some interesting tabs there, so you can get lots of different types of information. What is the PPE situation, Jeff asks. So the PPE situation is actually getting better. very happy to report that. So assisted living facilities, nursing homes got lots of shipments yesterday. Hospitals are getting direct shipments in. We have in our logistics staging area that's pushing out to nursing homes and assisted living facilities some PPE here. We pushed out a lot of personal protective equipment to our first responders and some of our nonprofit medical organizations that are providing testing. So we still have some supply here, and we've been pushing those out to the first responders as they need them. We did get a couple of requests today, and we're pushing them out for those individuals. Is it okay for a landlord to show a house that you're living in? I would think that that's probably not a safe thing to do right now. So if Kara, if you can tell your landlord that's not really safe, and I would prefer not people coming into my house that you're renting at this time. I think that's not that safe to have people. Right now, we want to shelter in place. We want to stay away from people. We don't want people that could be asymptomatic to come into the house and breathe and cough or sneeze or something like that on anything that we have, and we want to protect ourselves. Where can I find a list of test sites? We put those. Do we put all those up on the website?
No, we have the community health centers on.
Okay, so here's. I said that I would do it. So here I'm going to do it real quick. All four hospitals are testing. All emergency rooms. So all 4 standalone emergency rooms are testing. When we just called all of these, so we know that this is absolutely true. Advent Health Care, Centra Cares are testing. Centra Cares are testing. The American Muslim Community Clinic in Longwood, this is for low-income individuals only. Those that are underinsured or not insured, they are testing. Care spots are not testing. Care spots are not testing. So don't go to a care spot if you want to test. First Choice Urgent Care in Oviedo and in Maitland, they are both testing. Nemours Urgent Care in Sanford is testing. They are testing. True Health, which is in Castleberry, Sanford, and they also have a location inside of the Florida Department of Health. They are testing. And Urgent Care of Longwood, they are testing. Sheila asked, is there a place in Seminole County where essential workers can get masks? No, each business really needs to try to order masks or cloth or things like that. I went through Starbucks today to get us a drink, and everybody in the Starbucks had a mask on. It was good to see. So it would be upon the employer to determine what they are doing. Suzanne asked, watch out for scams, and Suzanne, you're absolutely right. There's a lot of people out there trying to sell PPE, and then but they require all the money up front, and then you never get your PPE. So only go with the trusted locations. Why is there only a $500 fine for quarantines and isolations? Unfortunately, that's the way our county code is written, so that's the extent of what we can order. So we are doing a $500 fine for that. Where can funeral homes get PPE? So funeral home, you can contact us if you can't find it anywhere else. We'll get with you offline to do that. Let's see. Can a job tell? So I already answered that question, and I think I answered all the questions. So again, our telephone number 407-665-0000. Again, 407-665-0000. We are staffed 7 days a week, Monday through Sunday, 8 a.m. to 5 p.m. You can go to our website, prepareseminole.org, for all kinds of information. Again, sorry for the little IT issue in between. We did not, of course, plan that to happen, like we haven't planned anything to happen in this event. We really appreciate everybody's patience. Seminole County is a wonderful place. The people here are just amazing. Y'all have suffered with us through some hurricanes. And you are battling through this just like we are, and I know it's challenging. We all want to be on the playgrounds. We all want to be in our boats. We all want to play. Well, not all of us, want to do those, but we want to do those activities. We want to be free to go shoot some hoops if we want to do that. And unfortunately, we're just having to get through this. So it's going to be a month, maybe 2 months. Hopefully, only that. And then we will be back to somewhat normal life. It will be a new normal, but it's somewhat new normal life. So y'all stay safe. We'll be back on Friday at noon, hopefully without any IT glitches, to get you updated. Thank you very much. Have a great day.